Oh, hi there. You're right on time for your appointment today at 2:30. Sorry, I meant 2:30. My name is Oliver. I'll be your dentist for today. I understand you're booked in today for a routine dental checkup and clean, as well as a wisdom tooth extraction. How are we feeling for today's procedure? That's perfectly okay. In fact, it's very normal to feel a bit anxious or nervous about a wisdom tooth extraction. But I assure you the x-rays we took at your last visit showed that just that one wisdom tooth is starting to protrude and impact in one of your mouth quadrants there. Fortunately, it hasn't impacted any of the neighboring teeth, but this is more of a preventative measure today. Yeah, just to make sure it doesn't start causing you problems in the future. Yeah. And of course, we'll be applying adequate anesthesia to the area locally to numb and make sure you have as least discomfort as possible. I'll be doubly sure of that, don't you worry. But before we begin, I just had a few questions to confirm. Can you give me your full name to begin with? Let's start with that. Okay, that's good. Always nice when you have the right patient. And just let me know, in the last week, have you been experiencing any pain or discomfort in any part of your mouth or oral cavity? Okay, very minimal. Good to hear. And have you been experiencing any cold or hot sensations in the mouth? Perhaps when having soup or having cold water? Okay. Noted that as well. It's good. We're off to a good start. How about any bleeding of the gums, maybe when you've been flossing or brushing your teeth? No bleeding. Okay. Very good. And lastly, you haven't been experiencing any jaw clicking, maybe when chewing or talking? Okay, very good. And have you or maybe a friend or partner mentioned that you grind your teeth at night time when you're asleep? Yeah, something we call bruxism. Has that occurred recently? No. Okay. No grinding of the teeth. Good. So it seems most things have stayed as they have been since I last saw you. So I think we're okay to proceed. But what I might do is just get my hands and equipment ready. What I'd love you to do is to sit back, relax in the dental chair there, and I'll just give you some protective eyewear just to prevent you from having to take a trip to the optometrist. Yeah, don't want you getting blinded from the lights. Okay. Here we are. This one here should do the trick. Just pop those ones on for me. Yeah, very good. And I'll just get my hands clean before we proceed. Like I said, today's procedure will be fairly quick. We're just removing the single wisdom tooth. I believe it's in your upper right quadrant, but I'll just double check that before we do anything. And we'll be doubly sure to apply enough local anesthesia so that all you'll really feel is some pulling or pushing, wriggling sensations. Very dull, very muted, nothing painful at all. But we'll talk more about it when we get to it. For now, I'd love to have a look at your mouth and do it clean. Yeah, just check those teeth as well. So I'll just get my gloves on. Okay. How's your day been so far? It's good. Good to hear. Taking it easy. No dramas, as I like to say. Very good. Okay. Much better. Alright, I'll just pop my mask on. Now, can you still hear me okay? Alright. Okay. If you can't understand me, I'll just have to pull it down. You let me know. Okay. Well, let's start with a bit of a visual inspection of your mouth or oral cavity there. Just opening wide for me. That's right. We'll just have a look there with my little Penlight. Okay. That's it. Yeah, nice and wide for me. Sorry, I'll just get in there so I can have a look. That's it. Just checking around in the cheek areas, in the upper right, upper left quadrants, lower right, and lower left quadrant. Just checking for any signs of swelling or redness or infection. Doesn't seem to be any signs of lesions in the cheek or mouth, oral cavity. It's good. And just while you're there, just swallowing for me. Just want to make sure that's good. Just checking out the back of your throat there, just the uvula, that little dangly thing. That's looking good too. And now just double checking, yes, it is that upper right quadrant where that tooth is starting to come through. Okay. One last check in the roof of your mouth there. That's it. Sorry, I know that gets quite bright in there, but nearly done. Very good. Hold still for me. Okay. Good to see. Alright, so everything's looking as it should be. Off to a good start. What I might do now is just a couple angles that are more difficult to see in your mouth. So I'll just use my handy dandy mirror here, a little optical dental mirror, just so I can get into all those little crevices, in the mouth there. So just the light one more time. Just having a look in through there. Good. That's it. Good. Okay. Just checking those teeth in the quadrant. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, and lastly 32. That's right, 32 fully healthy adult teeth. That's what we like to see, a full count. And, well, I lie, there's actually a 33rd just peeking through there with the wisdom tooth, of course. Today's elephant in the room. But what we might do is just get in there with our little dental little scraper. There's a little bit of tartar and plaque build-up in some of those teeth, not all of them. I can tell you've been looking after yourself with flossing and brushing regularly. At least I hope so. But so here we are, just a few little of my tools here. I promise you might just feel a little scratching sensation, but nothing too painful or anything like that. If at any point you feel like you need a rest or if it's a bit sore, just raise your hand. Okay, we'll take a break. It's no trouble. Alright, here we go. Just doing a brief clean on those teeth there. One. That's it. Okay. Now, how does that feel? Alright, that's good. Yeah, I know I can tell what you're thinking. Does he really know what I'm saying? How can he understand me when he's got his tools in my mouth? But dentists, we learn the syllables and we can fill in the gaps to understand what you're saying. So it's a skill. It takes time to learn, but yeah, we can understand you. It's good. Just keep that mouth open wide for me. And yeah, just scraping along the tooth there. Good. Okay. Here we are. Yeah, it just seems to be that one little section there, that lower left quadrant. Just a couple stubborn pieces of plaque there, so have to get in there with a little bit of force. Okay, that's it. Your mouth is going to feel brand new after this. Yeah, it's going to feel really strange on your tongue after. It's good. There we are, nearly done, my friend. Good. 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 Okay. That's looking good to me. So, just a few stubborn bits of plaque there, but nothing we couldn't take care of. So, let's have another quick look just to make sure we've got everything in there. Okay. All is looking good to me. Alright, give your mouth a bit of a rest there and feel free to use some of the water to rinse out your mouth as well. But let's move on. Okay, it's time for the wisdom tooth extraction. Now, as I mentioned earlier, this is a preventative measure, so we really want to make sure we get in there and extract it so that it doesn't cause you any issues down the line. Yeah. So the reason wisdom teeth have to be removed in the first place is because they can impact onto neighboring teeth, meaning that they can partially or completely either come into the gum line or in contact with other teeth. And this can cause some issues like redness, swelling, infection, and pain, which of course we do not want. I'd like to avoid that if we can. So, yeah, these tend to come in later in life, usually from the late teens or early 20s, but not everyone gets them, and not everyone can have them in each quadrant of the mouth. So just think of it as a normal part of human anatomy. Quite often there's not enough room for the wisdom teeth to come up. Yeah, so hence why the impacting can occur. So the wisdom teeth, turns out, are not so wise. But the good news is we can remove them. Quite a straightforward procedure. I'll make sure to apply adequate amount of local anaesthetic. Just using this little cotton swab here. We'll just get that over all onto those areas we plan on pulling at. In this case, in that upper right hand quadrant. Yeah, all the others are seeming to be okay on the x-rays. So it's good news there. Just the one tooth extraction today. But any questions at all? Yeah, that's a good point. If you feel discomfort or you need a break at all, like I said, just raise your hand. Let me know. I might just need to apply a little bit more anaesthetic to the area. And what to expect is just some gentle pulling or pushing or wriggling in that area with my little forceps. We'll use them to extract the tooth. So yeah, I'll be as gentle as possible, but really you should only feel a slight discomfort, like I said. So, okay, let's begin. We'll start with applying that anaesthetic, like I said. So just applying some on your lip to begin with, just on the top and on the bottom there. It's okay there, yeah. Top and bottom of the lip. There we go. Nice. Gentle in there. There we go. You should start to slowly feel your lip area gradually become numb or tingly. Okay, yeah, starting to feel that. Good. Alright, we're just moving into the oral cavity there. Say ah for me. That's it. Good. Hold that position. Just applying some more of that anaesthetic. Some more there. Okay. There we are. That's it. Alright. Now, if I tell you what, let's grab my little metal scalpel from earlier. Now, if we just stroking along that section there, how's that feeling? Good. Nothing? No sensation there? Alright, how about this area? Okay, you can still feel that? That's alright, we'll just apply a little bit more in that section. Good. Okay. Should be enough there, I think. just one more check. How does it feel now? Good. Can't feel anything? 0 out of 10 sensation. Okay, compared to this side? Yeah, okay. Alright, well that's good. I think we've got enough anesthesia on there now. So what we're going to do is just getting our little forceps here. Looks scarier, I promise. It's anesthesia is well and truly working its magic, so you'll barely feel a thing. Feel free to close your eyes if you prefer. Okay. Again, just raise your hand if you start to feel a discomfort that you will need a break. Okay, just getting in there. Sit. Gentle pressure there. It's good. Very good, you're doing great. So, just coming in there. That's it, just try to keep your mouth open. That's it, thank you. You're doing wonderful. Okay. Just a bit more pressure from this angle. That's it. Good. Nice. It's cooperating quite well, actually, your tooth. That's what we want to see. Excellent. Any discomfort there? No. Okay. All right. We'll keep going. Good. All right. That's looking good. Just a little bit more. Nice. Nearly done. That's it. It's just being a little bit stubborn, that tooth in this angle, but we're almost there. I promise we'll be done very soon. Good. That's it. Just prying the last of that one. Good job, and I think we've got it. There we are. Okay, you won't be needing that anymore. I'll just pop that one in our little tray there. That's good. But just hold still for me. You did excellently. Didn't need to raise your hand at all there, so that's good. I think the anesthesia really helped you out there. But all done. Yeah. Finito. Great job. All we need to do now is just put a little bit of that gauze in there. Just applying some pressure. Help soak up some of that fluid. That's it. And we'll get the healing process started right away. Okay. We are just one. Just get a few of those cotton balls of gauze in there. There we are. And again. Another one. That's it. Just tucking that one right into the corner. That's it. Okay. I think just get one more little bit of gauze in there. That's it. Okay. There we are. So that gauze in the mouth there will just help to apply pressure to that wound and soak up some of the fluid, blood in there. But that's all normal. That's okay. So, congratulations, the hard part is over. You officially no longer have any problematic wisdom tooth. I've taken that one out. Some people like to keep their tooth. Completely up to you what you want to do with it, but I'm happy to dispose of it in our clinic if you'd like. That's no trouble. But, okay. Well, let's get you cleaned up one more time there. There's just a little bit of saliva there, just suctioning that one up. That's looking good. Alright, now the anesthesia will still be in effect for a little bit longer, roughly maybe an hour or so. So that's normal. If your mouth feels a bit numb and tingly, that should start to wear off just naturally. But there's a few aftercare tips that you'll really need to keep in mind. So what I'd like you to do is try to avoid any, or rather stick to eating soft foods, like yogurt be a really good option for you. Soups, yeah, that kind of thing. Trying to avoid really hot temperatures though, or really extreme colds. The other thing to try is got some pain medication for you that you can take as required. And yeah, that's there just to help manage that sore spot there. It's going to feel like that for a little while. That's normal. So if you've got the pain medication there, feel free to use that as required. Otherwise, I'd love for you to do a salt water rinse of your mouth. Salt water rinse, but not until 24 hours after our procedure. So I guess that'd be about 2:30 tomorrow. 2:30. Yeah. Okay. Sounds like a plan. Just trying to think anything else. Yes, the gauze. I'll give you some in a little gift bag before you go. You can just replace that as you see fit, as the wound is still bleeding until it starts to clot. Then you can take that off. But in the meantime, I've got a little gift bag for you. So I'll pop some of the gauze in that bag for you. Yeah, just little kind of like cotton balls, really. You can feel free to stuff them in that little cavity corner there in the upper right quadrant. That'll help soak up some of that, that wound stuff, wound blood. But the other thing I would like you to have just a free little toothbrush here for all your efforts today. You've done well, so you deserve a brand new toothbrush, as well as some toothpaste. So feel free to take those ones home with you, as well as just some Eco Floss picks. Yeah, for flossing. Starting that up again when you feel comfortable. So just a few little goodies there and freebies to help you on your dental hygiene journey. Very important that you look after your mouth for general health. But that's all I have for you today, except for one last thing, a little appointment card. I'd love to see you again to see how you're going in about 6 months' time, if that works for you. Let's get you booked in. Here we are. Is 6 months okay? All right. And that will be with myself, Oliver, and anything happens from now till then, feel free to give our clinic a call. Otherwise, you can take this one. a little appointment card, and have a chat to our receptionist at the front, and she'll sort out your payments, insurance, etc. But thanks again for coming in. Honestly, you did superbly. A lot of people do get nervous for wisdom tooth extractions, and you did flawlessly. So you can pat yourself on the back there. But my name's been Oliver. Pleasure to see you, and I'll see you in 6 months' time. Bye for now. Thank you to my awesome patrons, Andres Orlan Vasquez, James, Astor, Scott Walker, Kirsten, Josh, Patrick, Gabriel C., Will Hume, Emma, Here's Mikey, Chad Moore, James P., Taylor,